Okay, we'll get started. Welcome to Raising Awareness into Health Disciplines. And today we'll be looking at optometry and occupational therapy. So aloha mai kako. My name is Lisa Leilani Ka'anoi from the Healthcare Workforce Development Center, known as Mauliola Malamalama at Papa'olalokahi, which is the Native Hawaiian Health Board. So mahalo for those that are joining us and those who will be joining us later via the recording. So just as you heard the little notification that this webinar will be recorded. And in the future, if there's a webinar that you'd like to see but aren't able to, as long as you register, you will receive the recording. We are a little bit delayed in our editing our recordings. So we're going to try to work on those and get previous presentations out as soon as we can. So mahalo for your patience. For questions or comments, you may use the Q&A feature or chat feature located in your Zoom toolbar. And then if this is your first time joining us, you will be automatically added to our email list for future presentations. And then last, at the end, there will be a survey that will pop up. And if you'd like to share your mana'o, this is where we get our ideas for future presentations. But if you do have to run afterwards and you don't have time to fill out the survey, we'll follow up on Monday to give you another chance. Okay, so why don't we go ahead and get started. And I will go ahead and have our first speaker. Is it going to be you, Liana, or Kulia?
It will be together, but Kulia will be presenting her profession first.
Okay. So for health professions, of course, if you ask kids, and the most occupations you think of automatically are nurses, doctors, surgeons. Most likely those are the ones that you'll see in movies or TVs and that's television. But as you well know, that health professions are all across the board. And so I'm very happy to introduce to you two health professions we don't hear from often. And so I'll go ahead and turn it over to Kulia and Liana to introduce themselves.
Thank you. Okay, I will share the PowerPoint now and we will introduce ourselves.
Okay, aloha everyone. Before we get started, we just want to mahalo you folks for taking the time to listen to our presentation today. My name is Kulia Fernandez and I'm going to dive into the field of optometry.
And my name is Liana Chee and I will dive into the field of occupational therapy.
Okay, so a little bit about myself. I was born and raised on the island of Maui. I am a proud alumna of Kamehameha Schools Maui with the class of 2017. I recently graduated from Pacific University in Forest Grove, Oregon, where I completed a Bachelor's of Science in Public Health, as well as a biology minor. Through my Bachelor's of Science studies, I have really grown a passion to advocate for accessible healthcare, especially in underserved communities. And I'm continuing my education at Pacific University's College of Optometry with the class of 2026. I'm currently a first year in their Doctor of Optometry program. And my hope is to return home and provide accessible eye care on the island of Maui.
Okay, a little bit about myself as well. I was born in the Philippines and I immigrated to Texas at a young age. And while I was there, I completed high school at South Texas High School for Health Professions, my Bachelor's of Science degree at University of Texas at Rio Grande Valley. And currently I'm completing my doctorate in occupational therapy at Baylor University. Now I am based on Oahu, Hawaii, as I'm completing my doctoral capstone internship with Papa'olalokahi. Due to my passion for serving Indigenous and underserved communities, I've decided to come to Hawaii for my second clinical rotation and my current internship. So my project centers around recruitment of Native Hawaiian scholars into the health professions, specifically occupational therapy. I've learned a lot during my time here so far through the Native Hawaiian community and the local community, and I'm excited to continue learning more as I become the best provider as possible for the community. Now, as for our learning objectives, today we will learn about what is optometry, what does an optometrist do, what is occupational therapy, what does an occupational therapist do, and what is the importance of having representation within the health disciplines to serve the Native Hawaiian community. Now for the significance.
So before we really dive into everything, like Lisa mentioned, there's going to be pauses in between my presentation as well as Liana's. So there'll be a little Q&A break. So if you have any question regarding my portion of the presentation, feel free to ask questions then. And if not, we'll also have another opportunity for questions at the end. You guys can also put questions in the chat. And also, Liana and I aren't really experts in our profession just yet, but we'll try our best to address any questions that you guys might have. So again, with the significance, before we dive into our health disciplines respectively, I just kind of want to give a little bit of background about the Native Hawaiian community first for those who might not know much about it. Through my undergraduate studies, I based my capstone around creating more culturally integrated health services to help Native Hawaiians navigate themselves through this generation and this society and time. My reasoning behind this research was to kind of enable Native Hawaiians to know their identity as Kanaka, because I believe that knowing your identity and who you are and where you come from can help alleviate the stress that colonization has put on us. And the stress that colonization has put on us kind of increases health disparities within our community. So Native Hawaiians really represent only a fraction of our overall population in the state of Hawaii, yet we're disproportionately faced with the highest rates of health risk compared to other racial groups within the state. In order to understand why this occurs, it's really essential to know the history of our Native Hawaiian people and to have an understanding of why our current efforts, why we're trying to restore and rebuild our heritage. So colonization really put Hawaii on the map for foreigners to come and spread their Western ways of living, as well as infectious diseases. And by putting us on the map, this kind of led to the illegal overthrow of the Hawaiian Kingdom, which started the many decades of oppression of the Native Hawaiian people. Following the overthrow, Native Hawaiians really lost their language and their culture, and all of that really faced near extinction due to this disconnect that we had with American individualism and Native Hawaiian collectivism, resulting in Native Hawaiians feeling displaced, and even in today's society. So the Native Hawaiian community right now is really in the works of reversing these longstanding consequences, and this trauma has really been passed down from generation to generation, which causes Native individuals to have increased rates of health risks.
In 1985, there was a needs assessment conducted titled Yolama, and that was the first study in which it was a catalyst in Native Hawaiian health. It aided in the passing of laws, such as the Native Hawaiian Healthcare Improvement Act, and as a result, Papalokahi was created to oversee this act and overall improve Native Hawaiian health and wellness. The 4 key findings of this needs assessment include the significant disparity in rates of chronic disease, the limited accessibility to health services, shortage of Native Hawaiians as health professionals, and preferences for culturally relevant programs and services. Although we'll briefly touch base on all of these findings today, our focus is to, of course, the shortage of Native Hawaiians as health professionals, and as well overall, just having general culturally competent providers of care for the Native Hawaiian community and their unique needs.
Okay, so before I dive into my passion for optometry, I kind of want to define what optometry is. Liana, would you be able to, yeah, there we go, perfect. So according to the Oxford Dictionary, optometry is the practice of examining the eyes for visual defects and prescribing corrective lenses. An optometrist is a healthcare professional who provides primary vision care ranging from sight testing, correction to diagnosis, treatment, and management of visual changes. And I kind of want to add that I feel like these definitions don't really accurately describe what we can do for patients. I believe optometrists play a major role in the individual's overall health and well-being by detecting and diagnosing systemic diseases, as well as treating and managing ocular manifestations from those diseases. So the scope of practice for optometry, optometrists are state licensed primary health professionals. So there are 3 different areas of scope of practice. There's practice authority, prescriptive authority, and surgical authority. And these scopes of practices are really determined by the State Board of Optometry. So that means optometrists in Hawaii may not be able to practice as much as an optometrist in a different state. So when I talk about practice authority, this really involves the optometrist's ability to perform foreign body removals, advanced surgical procedures. Prescriptive authority refers to whether or not an optometrist can prescribe certain medications and classifications of controlled substances. And surgical authority refers to like those surgical procedures, and that can range from laser treatments or anything that involves like the orbital structures. And then when it comes to the state of Hawaii, optometrists are somewhat limited in their scope of practice. Like they're unable to do surgical procedures, any laser procedures and injections. And I feel like when it comes to optometry, it's a very legislative profession. And I think it's important for the scope of practice to kind of expand, especially in Hawaii. So if, say, we see a patient and we're unable to do certain procedures, I feel like it's important that optometrists in Hawaii are able to expand this scope, so we don't need to send our patients to maybe someone else in a different state. So I think when it comes to legislative professions, it's really important to advocate for our profession so that our scope of practice can expand. There are many routes an optometrist can take in regards to what they want to practice. Some optometrists they choose to further their education. So when it comes to optometry, you need a 4-year undergraduate degree as well as a 4-year college optometry degree. And after your time in the College of Optometry, you can choose to do a residency. And these residencies allow optometrists to specialize in a certain area to have a deeper knowledge of that area. Some specialties range from cornea and contact lenses, low vision, pediatrics, neurooptometry, or even vision therapy. I don't really want to go into further detail because I don't really know a lot about these specialties just yet, but in regards to this, I did find a website that summarizes these specialties. If anyone wants more information, the link is at the bottom of this slide, and they do a great job into going into detail about what these specialties can do for their patients. So I want to look at the bigger picture here because I believe there's a lot of misconceptions about visiting an optometrist. Many people believe that if you have clear vision, you don't really need to see an optometrist. But I think clear vision is really just the beginning. Through comprehensive exams, optometrists are able to identify early warning signs as well as manifestations of chronic diseases. There are more than 270 systemic diseases that can be seen by looking at a patient's retina, and these diseases can include cancer, diabetes, and hypertension. There's a difference between comprehensive eye exams as well as vision screenings. Like I mentioned, comprehensive eye exams include dilation, and this allows the doctor to kind of look further into the health of their patient. While vision screenings, there's a need for further evaluation after these screenings. So we always recommend to have a comprehensive exam versus just a vision screening. Some may ask, well, why is an eye exam so important? And according to a website, they gave a little statistic that 1 in 5 Americans can see, or they say that an eye professional detected and diagnosed an underlying health condition. And I believe that early detection is key to be proactive and to help your patient kind of maintain their health and kind of alleviate anything that can possibly show up. So even though at a young age I fell in love with the field of optometry, I knew I still had a kuleana to my native community. And I was trying to think of a way of how optometry is significant to us as Kanaka. So like I mentioned before, there's more than 270 systemic diseases that can be detected through the eyes, such as cancer, hypertension, and diabetes. And I chose to focus on these specific diseases just because I know that the Native Hawaiian community is susceptible to these diseases. These are just a little bit of statistics that I found. When it comes to diabetes, Native Hawaiians are about 2.5 times more likely to be diagnosed compared to other ethnicities. Cancer, Native Hawaiians carry the highest cancer mortality burden in Hawaii, and relative to other races in the US, Native Hawaiians have the highest prevalence of hypertension. So I kind of created this map to kind of show an overview of what I'm going to talk about today. So I mapped out the 3 chronic diseases that I'm going to dive into and how these diseases can lead to eye-related diseases as well, and what we as optometrists can do to either educate our patients or take preventative measures if these chronic diseases are caught at an early stage. So the first disease is diabetes, and I kind of linked diabetes to diabetic retinopathy. So in general, individuals with diabetes are more likely to have eye problems, and diabetic retinopathy is just one of them. So what is it? Diabetic retinopathy is an eye condition that can cause vision loss and blindness in people who do have diabetes. It affects blood vessels in the retina, and your retina is a light sensitive layer at the back of your eye. And this, when a patient has high blood sugar due to diabetes, over time, having too much sugar in your blood can damage your retina. And why is it important to manage? Well, diabetic retinopathy, they may not have symptoms at first. And in order to really know if you have it or not, is to have these annual checkups with your doctor. And through dilated eye exams, the doctor can really see and help you take the next steps to protect your vision. So in comparison to early stage and late stage, finding out whether a patient has diabetic retinopathy, like I mentioned, in early stage, symptoms might not occur or patients might not notice it. And it's nice to know and catch these diseases at an earlier stage just to be a little bit more proactive. Some people might ask, how do you manage this? And we always, over time, when I interned, I've always heard doctors talk to their patients who have diabetes to just manage their blood sugars and make sure that their sugar levels are in normal ranges and they're just taking care of their overall health. So when it comes to cancers, there are 3 most commonly detected forms of cancers that an optometrist can see within their patients are brain cancer, melanoma, and leukemia. And although these are very extreme cases, these still occur in patients. And when it comes to melanoma, like I said, a doctor can really only see this through comprehensive exams. And when they're looking through the pupil, if maybe their pupil doesn't react properly, or if they're looking at the back of their eye and they see dark spots, this could probably be a sign of cancers. And if an optometrist does see this, then they're just going to educate their patient on what they see, and they can refer them to like retina specialists or refer them out to other healthcare professionals that can help. In order to really know and diagnose this, optical imaging is taken, and this is like in an inexpensive way and a non-invasive way to detect these human cancers. So again, like I mentioned, it's really important for patients to annually see their doctor. That way, doctors can keep track of seeing whether this dark spot that they're noticing currently has been something they've seen in the past, or if it just popped up within the last year or so. So in regards to hypertension, how can hypertension damage your eye? There are different ocular manifestations that hypertension can cause. There's retinopathy, optic neuropathy, as well as stroke-induced vision loss. Hypertension, when an optometrist looks at the back of a patient's eye, they notice a lot of blood vessels, and the blood vessels within a patient's eye is connected to the rest of their blood supply throughout the whole body. So when an optometrist looks at their retina, they can really tell the overall health of the entire person's body. If they notice maybe a kink or some bleeding spots within the retina, they can link that to hypertension. And sometimes patients don't even know they have high blood pressure unless a health professional tells them about it. When it comes to hypertension, it can damage your eyes and your vision. In order to help patients prevent this, doctors recommend them to keep their blood pressure within normal limits, just to prevent ocular problems from occurring. For things like retinopathy for hypertension, patients might experience blurred vision, blindness, and this can be caused due to the shortage of blood flow. When a person may, for example, experience a stroke, high blood pressure can trigger this stroke. And sometimes strokes can block a person's vision, and sometimes they're unable to gain that vision back. So the importance of community, I found that over time, actually, this all kind of stemmed from my time interning over the years. Since high school, I have interned with a small private practice on the island of Maui called Maui Optics, and they provide advanced and accessible eye care to the local community of Maui. They really sparked my interest in community outreach and eye care programs. Their practice tends to travel to clinics in the remote parts of Maui County, such as Hana, Lanai, and Molokai, and they provide accessible care to those underserved members within Maui County. Their humanitarian efforts really inspired me to kind of create my own outreach program back in high school, and I wanted to serve the Native Hawaiian community somehow. I partnered with Project Vision Hawaii as well as Maui Optics, and they helped me organize a vision screening back in 2016 with the Kamehameha School's Maui 4th grade class. So I believe I saw a total of 40 students, and these students went through a series of 3 tests just to see how well they're seeing in the classroom and how well their eyes work together. Of those 40 students, I had about 7 referrals, and out of those 7 referrals, 1 student did get glasses for his vision. Even though I know 1 student got glasses, just the fact that I know that someone's vision was enhanced through optometry was really comforting to me and really inspired me to keep pursuing this, I guess, providing vision care for the community and just going out through these outreach programs. The importance that I believe that optometry has for the community is just understanding that sometimes maybe it's important for health professionals to go out to the community and not just expecting patients to come to them. Over the years, I have realized that the career and the field of optometry does allow me to support Native Hawaiians. And I believe that in order for this to happen, that community outreach programs is the way to go. Okay.
Great. Mahalo, Kulia.
Thank you.
Is now a good time to ask for questions? So if anyone has any questions for Kulia, I have one. What is the difference between an optometrist and an optician and ophthalmologist?
So an optometrist is mainly just the person who kind of looks at how a person is seeing, and they can really detect diseases. I feel like the expansion of optometry has grown. A lot of people don't realize that diseases can be detected from their optometrist. Normally with ophthalmology, they're more of the surgical doctors. They go through medical school, they're MDs, and they specialize within the eye. So normally with optometrists and ophthalmologists, we work together where optometrists are the first people to see patients and say, okay, you have a cataract. I'm going to need to refer you to an ophthalmologist because I've noticed over the years your vision has really been impacted from this cataract. So optometrists and ophthalmologists really work together to help their patients see properly. So optometrists are mainly the first people to see the patient and notice they have a problem, kind of monitor it to see how it's impacting their vision, and then they'll refer out to an ophthalmologist. I don't really know the scope of practice for ophthalmologists, so I don't know how expansive their career is, but there are other specialties like a retina specialist and a glaucoma specialist. So patients will go to them if an optometrist feels the need for it, and they'll refer them out. Opticians are mainly in charge of glasses. So they take the prescription from And a prescription is just an optometrist, I guess, how do I word this? Their professional opinion on how well their patient could see with this prescription. So an optician takes the prescription and kind of forms the glasses for the patient and helps the patient like wear the glasses, because sometimes with certain prescriptions, patient may feel dizzy or they just need time to take to get used to the prescription. So opticians kind of communicate how glasses work and like what's the best option for them. So they don't really have like a medical degree.
So thank you for that. Do opticians also not only do glasses, do they do contacts as well?
I know they process the orders for contacts, but optometrists are really the ones to see if contacts fit properly within the patient. Yeah.
Great. Mahalo.
You're welcome.
Okay, Liana.
Now we'll move on to the field of occupational therapy. Now, to understand what occupational therapy is, we have to divide the two words. So first, occupation. Occupation in the occupational therapy profession means everyday activities that are meaningful and impactful for the client or the individual. So these can include things that we take for granted every day, such as brushing your teeth, getting dressed, things that are very important for us to be independent and go about our day. Also, occupation can mean activities that are meaningful to you outside of that, such as for me, one of my occupations or hobbies is dancing. So these are the everyday activities that we find very meaningful to ourselves, and everyone has their own occupation. So if you would like to, you're very more than welcome to share in the chat too what your occupations are. Do you like to cook? Do you like to clean? Some people like cleaning, you know. And then for therapy, the word therapy means treatment or healing. So if you combine the two words, occupational therapy, it means a therapeutic use of these meaningful activities or occupations to work with persons, groups, or populations and to promote their participation in their meaningful occupations. So we work with clients that have experienced injury, illness, or disabilities. Now, what exactly is an occupational therapist? An occupational therapist is a health professional that has received the proper education and training to work with individuals of all ages and all walks of life. So they use their knowledge to build a rapport. We get to know the client and they get to know us. That way our therapeutic process is seamless and we build a connection. We help them engage in their meaningful daily activities through our treatment. And in order to develop our treatment, we do evaluation. So first we see how they are doing. Then we develop a treatment plan and of course enact that treatment and help them achieve their goals. So overall, occupational therapists, we help patients gain and regain their their skills needed to complete their meaningful skills. So this also meaningful activities, sorry. So this includes also promoting physical and mental health and wellness for all of our clients. Now, there are actually two kinds of occupational therapy professions. First is the registered occupational therapist, and their role is to evaluate patients, as I mentioned, create treatment plans and treat patients and collaborate with their team. The education required to become a registered occupational therapist, there's two educations in which you can, or pathways you can decide to go into. So that there's a master's in occupational therapy, an entry-level doctorate in occupational therapy. So in order to get into these programs, you would need to get your high school degree, an undergraduate degree with prerequisites fulfilled. The undergraduate degree spans to about 4 years. And then 2 to 3 years of the graduate level program of the MOT and the OTD program at a university. After graduating from this program, you must pass the board exam or the NBCOT certification exam, and then fulfill any state requirements. In the state of Hawaii, I believe for the state licensure, occupational therapists just need to apply and comply with any requirements they have for licensure. Next, the next kind of professional of occupational therapy is a certified occupational therapy assistant. So they work under the supervision of the occupational therapist, but they also create a treatment plan and treat their patients, build rapport, and collaborate with the team. Now, the education required in order to become a certified occupational therapy assistant include high school degree, prerequisites for the program at a college level, and then 2 years of the certified occupational therapy assistant program at a community college level. Now, after completing that program, you also have to pass the board exam and of course fulfill any state requirements. Now, there is a certified occupational therapy assistant program here on the island of Oahu at Kapi'olani Community College. And there are talks of, I believe it's in the works, of an entry-level doctorate program that's being developed by Hawaii Pacific University. So it'll be important for people, locals and people who are interested in serving the community to attend these institutions in order to better serve the community and give back to the community that, of course, raised and nurtured them. And yeah. Next, there are several areas of focus for the occupational therapist. We're not just limited to one. First is the inpatient setting. So this means that the patient will be living within that institution or that facility. And these include acute care, rehabilitation facilities, psychiatric hospitals, or mental health hospitals, community and specialty focused hospitals, nursing facilities, and even prisons. Next is the outpatient setting. So these include, this means that they wouldn't be living there long term, but instead they'd be visiting these facilities every so often to receive care. So these include hospitals, outpatient settings and hospitals, clinics as well, medical and therapy offices too. Next is the home and community setting. So these include residences or group homes, assisted living, schools, even early intervention centers, daycare centers, industry and business, hospice, homeless shelters, transitional living facilities, wellness and fitness centers, community mental health facilities, public and private transportation agencies, park districts, and work sites. And then lastly, our research facilities, where occupational therapists focus on conducting studies, trials, and overall help improve the quality of services that we provide for our patients. Occupational therapists are evidence-based practitioners, so we are dedicated to being lifelong learners and always improving the profession. Next is the scope of practice. I decided to divide the scope of practice into 2 sections. So the scope of practice refers to activities that a licensed occupational therapist is allowed to perform as according to the board certification as well as state license or state legislators or state statutes. So first is domain, and we focus on, of course, the foundation of the client. So we have to understand their everyday life occupations that make them who they are. As OTs help our clients participate in their everyday life occupations, their roles, contexts, life situations, and overall, we help them emotionally, psychosocially, cognitively, and physical aspects of their performance in regards to their occupations. Now, there are several types of occupations or the way that we divide them. First is the ADLs or the activities of daily living. These are things we do every day, such as brushing our teeth and combing our hair, dressing. So important everyday things that we have to do to be independent. And IADLs are those that are, or instrumental activities of daily living are those that are kind of parallel or similar to the ADLs in which they are required or they are meaningful, but they're also, but not everyone has, for example, an IADL is doing laundry. Not everyone may be able to, or it does their laundry or managing money, they might have someone else that'll help. So these aren't things that aren't us focused on, or just our independence ourselves, and in ways are instrumental. Next is health management, of course, such as taking care of yourself, medication, rest and sleep, education, work, play, leisure, and social participation. So these are the different sections in which we divide our occupations, and we address them accordingly as occupational therapists on what is important to our client. Next, for the scope of practice is the process. So how do we help our clients get back to doing what they love and what they need to do at home or wherever they are staying? So process delivery of our occupational therapy services. So this includes evaluation. So first we, like I said, build a rapport, build a connection, learn about the client and what's important to them, analyze what they're able to carry out in their everyday life activities at home or wherever they live, and then of course address any occupational needs they have, strengths, and any barriers they have to participating in their occupations. So once we have a good evaluation of the client, we create a treatment plan, and this is where intervention comes in. So we implement the treatment plan and services to the client, and this is through education, training, advocacy, group interventions, and even virtual interventions. And the last part of process is, of course, the outcomes. We want to really help them achieve their goals, achieve their health, well-being, and participate in their occupations. So an example of the scope of practice in play, I have two diagnoses that are commonly seen in occupational therapy. So first is a school-age child with developmental delay. So let's look at the role of a school-age child. They are a student, but they're also a growing child as well. So at this age, it's important to know how to be independent in dressing yourself, in brushing your teeth and feeding it yourself, because you're no longer at home, you're at school. And another important thing for students is to know how to write, also do the activities at school. So this is one of the main delays that are one of the main issues that school-age children with developmental delay face with is a delay in visual motor integration. So that's essentially the way the hands communicate with the eyes. So if I'm faced with a client that is school-aged and I see that they have developmental delay and visual motor integration, I help create activities that help address that. For example, I worked with a child in my fieldwork who had trouble with her visual motor integration, her fine motor skills. And one of our main goals was to help them button up their shirt so that they may dress themselves. So we would do any activities such as Play-Doh or blocks to kind of address the baseline or address the foundation of those skills, and then later translate them into the actual skill itself of buttoning themselves. And then next is a middle-aged male or female with a CVA or a stroke. So as mentioned by Kulia earlier, that oftentimes people that have stroke also encounter visual deficits. So let's look at the picture here. This is a middle-aged person who's been used to being independent on their own and doing everything for themselves, but now after experiencing a stroke, they have hemiparesis, so meaning that they have a weakness on one side. If they were their dominant side, then we would have to teach them how to be more independent with their other side, vice versa. And another thing that a CVA or a stroke also comes with sometimes is visual neglect. So visual neglect is their inability to see one side of their vision. And that is due to just the way the brain was affected due to the stroke. So oftentimes, let's think of someone who, like I mentioned, has been used to being independent, feeding themselves, but now that they've experienced a stroke and they have visual neglect, we have to teach them the proper methods and activities in which they can still independently feed themselves, but working with the visual neglect and the hemiparesis in other ways to go around it and be independent again. So these are just two examples in which occupational therapy addresses these two diagnoses and these two deficits. Next for this slide, I would like to touch base on occupational therapy and chronic disease management. So oftentimes we already, especially for those that are adult age and older, we already are faced with adults that have chronic diseases. So a lot of what we do is management for our patients, such as addressing their performance deficits, teaching strategies for energy conservation and activity modification techniques, individualized adaptations for health management, teaching and incorporating health management tasks into existing habits, part of their daily routine, and of course, developing any coping strategies, behaviors, and habits to complement their lifestyle adaptations and routines. Now, next, I would like to touch base on cultural competency and cultural humility as a practitioner. As an occupational therapist, as I mentioned, we work with clients of all walks of life and all ages. So it's important to really have cultural competency and cultural humility. First, cultural competency is about learning about another's culture, language, set of customs, beliefs, and patterns, and our approach to culturally responsive and sensitive services. Next is cultural humility. So that's self-awareness and self-reflection, recognizing own biases and limitations, being open and respectful, having willingness to learn, and of course, having both cultural competency and humility. As someone that is not from Hawaii, I come here with a very open mind and willingness to learn. I take initiative in learning from community members and community leaders to learn about the population that I serve, and of course, to become the best practitioner that I can for this community. And coming here has been a different perspective for me, and I wouldn't have had it any other way. I feel that I'm very well equipped to be a culturally competent and culturally humble provider, and I'm continuing to learn. So it's always an ongoing process. So any questions about occupational therapy?
Awesome. Mahalo, Liana. So I'm just curious, what does it look like for occupational therapists? Like, is there a high need for them, or like how many are there in the state of Hawaii? Do you happen to know those numbers?
I don't happen to know those numbers, but as part of my time working or doing my clinical fieldwork at the hospital and engaging with professionals, even at the association level, I just know that there is a need for occupational therapists, especially for the rural areas. Just from my knowledge, I know that most of the healthcare is based here on Oahu, and that there's ongoing need for outer island occupational therapists.
And then there's a question. You seem very passionate about occupational therapy. What do you think sparked this passion for you?
Yes, so occupational therapy sparked my interest as I was exploring the potential fields that I was going to go into early on to college. And my brother is actually a physical therapist. So in contrast, physical therapists really focus on the mobility and the client's ability to move. But as I looked deeper into rehabilitation itself, I found it so beautiful that occupational therapy focuses on those meaningful activities that people have, that we really take for granted every day. And I think it's important for everyone to do what they love. And that's what I really want them to be able to do.
Nice. Any other questions, comments, feedback for up and coming doctors, students who are doing so well? Oh, we have one from Auntie Kathy. Aloha, Auntie Kathy. So Kulia, I'd be interested in hearing more about legislative and similar hurdles you're aware of, since it sounds like optometrists in the state of Hawaii do not have the same scope of practice as your peers on the continent. It's an interesting question.
That is. So we're kind of learning that right now in our practice management course. We're just learning that the scope of practice in some states, like optometrists are able to do like laser procedures, like I mentioned, but in Hawaii, we're not allowed to do that. So our professor keeps honing in that optometry really is a legislative profession. So if we want things to change, that we need to take this kind of like from a political standpoint and advocate for ourselves as healthcare professionals, because if we advocate for ourselves, we're also advocating for our patients. So I think when it comes to legislative, that we have to also just be open-minded that sometimes when it comes to practicing, we don't just stay within our clinics, that we have to also take this to either a state level or even federal level so that the scope of practice can expand for other states as well. I don't really know too much detail about how to go about that process just yet, but I'm sure down the road throughout the years, I can learn more about how to take initiative from this legislative perspective. I hope that answered your question.
Great. So, mahalo Kulia, it's interesting that everyone needs to go beyond their professions. Yeah. So, what would you tell someone who hasn't decided what they wanted to do in healthcare? Like, let's say it's a high school student, and they're trying to figure out what to do. What advice would you give them?
I can start first. Personally, for me, the way I found occupational therapy was through hours. So lots of hours and observation, and also taking the initiative to learn about these other occupation or other healthcare fields that exist out there.
I would definitely agree with that. I started interning back in high school, and I think interning, you kind of get this one-on-one experience with a doctor, as well as you get to sit in sometimes if patients allow you to sit into their appointment. You kind of get to interact and see what the profession is like and see if you can connect to patients like that. And I started, I believe it was my junior year of high school with optometry, and I knew I liked it, but I knew it was also important to look at other professions to see maybe if I connected with those as well. I mean, I didn't, and I really liked optometry a lot, so I stuck with that. So you really only know what you want to do through shadowing, interning. So just getting out there and seeing what you like.
Getting introduced to it and exposed to it.
Yeah, yes.
So are you calling from Oregon right now?
I am.
Forest Grove?
Yes.
And how is it over there?
It is freezing, but it's the fall just kicked in. It kicked in a little later than normal, but it's just been gloomy for like the past couple of weeks.
What time is it there?
Right now it's about almost 3 o'clock.
Oh,
it's not too bad.
Not too bad. Pauhana Friday.
Yeah.
Mahalo, Liana, for your presentation and passion. My mama was 93 years young, benefited so much from the gentle and caring kuku of different OTs she worked with recently. Sweet.
Thank you so much for sharing. I'm always so inspired when people tell me that occupational therapy made a difference in their lives. It helps me to drive forward and keep going.
Great. Awesome. So if there aren't any more questions, I just want to mahalo Kulia and Liana for taking the time to meet with us today. And this was Kulia's first Zoom presentation, so I think she did pretty good. And for our next webinar, so our webinars are every second and fourth Friday of the month, unless they fall on a holiday. So coincidentally, November, they're both holidays, so we're not going to have any webinars next month. The next one will be December 9th, and that one is yet to be determined, but we'll be sure to send you all an invitation to that. And then I also wanted to mahalo Kaimi Pono Hano Hano and Kamoala Kalai for being my back-end support on this Zoom webinar. And just malama ki kahi ki kahi, and we'll keep in touch. So ahui ho, everybody.
Ahui ho.